He's in about 15 minutes to go back up. Now, a lot can happen in that time. I want you to come with me, Dr. Rahul Sharma. He's an emergency room doctor from New York Presbyterian Hospital. He just came into the newsroom, and I want to ask you some questions. Doctor, thank you so much for joining us.
Thank you, Angie.
This has got to have a huge psychological impact on these men they've been trapped for 10 long weeks down, and now they're going to be riding in a tiny capsule. What could be going on psychologically for these guys?
Well, I think certainly they could suffer from a panic attack, some anxiety. They've been around people for the last several months, and now they're going to be alone for maybe even an hour. So an anxiety attack in the initial state could certainly happen. Long term, we're talking about depression, post-traumatic stress disorder, some sleeping pattern changes as well.
Okay, we're all concerned about their eyes. We're hearing that when they come up, they're going to be wearing special sunglasses that guard their eyes because they haven't seen sunlight at all in 10 long weeks. What are we concerned about with their eyesight?
Well, we want to minimize exposure to ultraviolet light initially. Their eyes are used to being in the dark, so they are going to be having sunglasses. There shouldn't be any long-term effects as long as they protect their eyes from cameras and daylight.
Okay, now when they first come up, they're going to be taken to the hospitals, they're going to be monitored. What will doctors be looking for? What's the first thing they'll want to look for? Well,
when they initially come up, they're going to get triaged. As like any triage, their airway, breathing, circulation is going to be determined. They're going to have vital signs checked. And after that, they're going to be sent to another hospital where they're going to have a more detailed evaluation on their nutritional status, their hydration, as well as other medical conditions that might be going on.
Right, it's hard to imagine being trapped for so long, and their bodies must change when they're in, such a close environment. What could be going on with their bodies down there? Because I don't think they have a lot of room really to move around.
No, so certainly this is why they are having some of the healthier and younger miners come up first, because they could get dizzy, they could have some low blood pressure, which might result in them fainting. They might get a little dehydrated as well, so they're getting salt tablets, they're getting properly hydrated, and they're having some pressure devices on their lower extremities to make sure they have enough blood flowing to their heart.
Very, very interesting. Doctor, thank you so much for being with us tonight. And we will be monitoring the situation very carefully in our newsroom and bring you the very latest as it comes in throughout the hour tonight. For now, I'll send it right back up to you.
Andrea, thank you. Let's get some more detail.
Joining us right now on the Newsline is Dave Loriski. He is the former Assistant Secretary of Labor for Mine Safety and Health. Now, he served during the rescue of 9 miners in Somerset County, Pennsylvania. That happened back in 2002.
And he's currently the president of Safety Solutions International. Okay, question. The rescue here is very similar to the rescue at the one at the Q Creek mine in 2002, but this mine is actually 10 times deeper than the one in Pennsylvania.
Exactly. It's a whole set of circumstances that are different relative to the distance that this capsule has to travel to get these miners to safety. But there's a lot of similarities in terms of the techniques that are going to be used to bring the miners to safety.
What's the biggest challenge here?
Well, the biggest challenge is the unknown, in my view, and that's, for each trip that they make, either up or down that shaft, is not knowing what they might encounter as the capsule is either ascending or descending. And fortunately they have cameras on the capsule itself so they can have some idea, but still there's a certain amount of not knowing, if you will, that will keep the tension levels fairly high while they extract the miners.
So Dave, when you say a certain amount of not knowing, are you talking about the terrain conditions or the health of the miners as they're coming up? Because we heard something about the possibility of falling rocks or something like that.
Well, I think it's a combination of things. I think one is the anxiety that certainly the miners are going to go through as they're coming up through 2,000 feet of rock in a very small confined area. But principally it's the unknowns that you have dealing with the earth itself and whether anything can change, in a very short period of time. And when you're in mining, that's a situation that you have to deal with almost daily. So there could be a sudden movement, a sudden change that they have to be prepared for. And that's the unknown that I think I talk most about.
Yeah. This is an incredible distance, though, that they have to travel. I mean, it's 2,600 feet. They have to make the trip, the round trip, several times before everybody is really safe and sound. Is there the possibility of wear and tear on the equipment? In that, they make it the first 6 miners out. and then the rest of them may be stranded until they kind of recoup the equipment.
Well, I mean, certainly that's a possibility. Anytime you're dealing with mechanical structures or mechanical equipment or Mother Nature in this case, there's a certain amount of risk that you take. Mm-hmm. And there's the unknowns that I talked about. If something fails on that capsule or something fails the shaft, then I think that there has to be a contingency plan. You know, and knowing what I know about what they've done there, I have to believe, as well thought out as they've made this, that they probably have those contingency plans in place.
So, Dave, we're looking at live pictures right now out of Chile, and we are looking at one of the rescuers who is actually getting into the capsule right now. I guess he is about to secure himself, and they're going to send him down there. Tell us, how much time and what will they be doing? I mean, as he travels down there, how much time do you think there will be between when he gets down there, settles in, and then they send somebody up?
Well, you know, I'm not exactly sure. I'm sure he's going to assess the situation when he gets there. It's obviously going to take them some time to get him down there. I suspect that as they're going down with the rescuer, that he's going to be communicating with them, telling them what the conditions are that he sees, telling them that there's anything that they need to deal with on the surface. But when he reaches the miners, I'm sure there's going to be great jubilation on everybody's part.
Sure.
And it's going to take them some time to get people settled down and get the plan put in place, get the first person on the capsule and brought to the surface.
Right. You know, we should mention here that we are looking at live pictures. That live is really in quotes because this is on a 30-second delay. This is being controlled, actually, by the Chilean government. They are saying that they're going to continue to broadcast what is happening here, but they do want to make sure that if anything unpredictable does happen, that this feed is not broadcast to the entire world, because the entire world is riveted to this tonight, Dave.
So Dave, can you see these pictures?
No, actually, I can't. I'm in a vehicle traveling to one of your studios.
Okay, because it looks like they're securing some oxygen tanks at this moment.
Right. I think they have put the oxygen on there for the miners that they're going to bring out. I think they're going to ask the miners, at least from what I understand, to wear oxygen masks so as they ascend to the surface that they are getting good air that will help from any kind of tension that they may have, as well as provide them adequate oxygen supply as they come to the surface.
So when you're dealing with this kind of depth, you also have to worry a little bit about something called the Benz or Caisson's illness. Is that correct?
Well, I don't know in this case, but certainly at Q Creek that was a concern of ours, because one of the differences between what we see here in Copiapó as opposed to Q Creek is that in Q Creek there was a water buildup inside the mine that was narrowing really the amount of area that the people had to survive in, and so that created pressure. And so we were concerned at that point whether or not that pressure could create the bends for any of the people as we brought them to the surface. I'm not sure that's the same situation here in Copiapó, because they haven't been in an environment, at least as I understand it, that has put any kind of undue pressure. But certainly I think that by the fact that they've involved some other experts, the medical community, that's something that they have to consider. And, you know, they're the experts on the ground. They know the conditions better than I. So I think they've done a remarkable job, and I'm sure that they have this planned out as well.
Dave, let me ask you one last quick question. How are they going to deal with anxiety in these guys? Because it's such close quarters.
You know, I don't know. I mean, we're dealing with humans now. So how do you know how someone's going to react to certain situations? I have to believe that, you know, that they're going to be okay. They work in an underground environment. I think they understand. At least I would, think they should understand what the circumstances are going to be when they get into that capsule to come to the surface. Sure. And I think they fully understand the distance that they're going to have to travel to make that ascent.
Well, we certainly hope for the best. Dave, we really appreciate your joining us tonight, and thanks for lending your expertise. Dave Lariski joining us, the former Assistant Secretary of Labor for Mine Safety and Health. Dave, thank you very much.
Thank you.
And of course, you can get the very latest. We'll be checking in throughout the newscast, but also our website, myfoxny.com, for more. Meantime, the weather. It's sort of settled, but not for very long, I guess.
That's right. We're going to take a first look at the forecast right now. New York Weather Authority Nick Gregory joins us. Nick.
Well, Darren, Harry, we're going to have at least a little respite from the rain, which ended earlier this morning. 69, 59 today with the sun really present this afternoon. Mid-60s where we should be this time of the year. That's where we'll be tomorrow. And right now it's 61. The sky clearing out, the winds out of the north to northeast. The pressure rising, all some good weather signs. Do have frost advisories, though, up north tonight on into tomorrow morning for northwest Connecticut and the mid-Hudson Valley. Let's go to Fox 5 Sky Guardian in the live sweep. And we're not seeing anything to report. A couple of showers are way south of town earlier, but it is going to stay dry. So back to the weather graphics we go. I want to show you the future cast here. And as we do that, again, I'm going to show you that things are going to be improving as we go into tomorrow. On our weather graphics here, you'll see that coming up. Definitely looking for some better weather coming our way as we go on in towards tomorrow with that high pressure building on in. So it's going to be a sunny day, and we'll say mild for this time of the year, middle 60s, but the clouds come back by Thursday morning, and then a nor'easter develops along the coast. That could give us some pretty hefty rains later in the week. Clear, cooler tonight, 48 in town, 38 suburbs. Sunny tomorrow, mid-60s. Check out the 7-day. The rain Thursday afternoon into Friday morning. Heavy at times at night. Windy on Friday, then drying out in time for the weekend.
Well, we continue tonight following breaking news for you.
Look at some live pictures right here. This is out of Chile, where the rescue operation to pull out those 33 miners has begun. We're following it for you, and of course, we'll bring you the very latest throughout the newscast with more live pics.
Be sure to keep it where you've got it.
Harry and I'll be back. Just 2 minutes.
Have you seen Good Day lately?
How do you get to